current graduate students in the MHA program, as well as admission representatives from the program. Panelists, thank you for being here to speak on this exciting topic. Why don't we have you introduce yourselves, share your name, your role, organization, and a short summary of what you do.
I can go first. I'm Kristy Strain, and I am a second-year MHA student at the University of Minnesota. I'm really interested in the Medicaid population, and so I'll be going to Geisinger Health System out in Pennsylvania in July, working with their health plan.
My name is John Wiehe. I use he, him pronouns. I am a first-year MHA student, so just coming up on the end of the first year. This summer, I'm going to be going to Intermountain Primary Children's Hospital down in Salt Lake City. I'm particularly interested in pediatric delivery of care, so really interested to learn more from that organization this summer.
I can go next. My name is John Wittenborg. I'm from MHealth Fairview. I currently work as a workforce development consultant in human resources. Have been with Fairview for about 35 years in a variety of leadership roles previous to my most current role.
I'm Percy. I'm a student services specialist in the MHA program. A lot of what I do is work in the admissions area, as well as sort of just logistics and things for the program in general.
And my name is Katie Kaiser, and I'm a program coordinator in the School of Public Health. And I work with the students on their courses and graduation and kind of everything in between.
Awesome. Thank you for your introductions, and we'll dive right in. And so the first question can be answered by anyone. The question is, tell us about healthcare administration as a field, both if that is something that a student is studying as an undergrad or grad student, or for someone coming into the field from an alternative educational path. You can get maybe 2 responses for this question from 2 different perspectives.
Well, I can start with that. I think in my years of, I've been in leadership roles over 25 years with Fairview, and I've had the opportunity to work with individuals who've landed in leadership positions from both, in terms of both ways, people who were individuals in a graduate program who then became a master's in healthcare administration fellow with the organization who ultimately landed a position within the organization, sometimes a manager or a director level position after their fellowship had concluded. I personally did not go through a graduate program, but and worked with a number of individuals whose pathway was much different. They had started in a lower level position and achieved more opportunity through just the opportunities to advance their career as they grew in their various roles. And that's pretty much the pathway I've been on.
Yeah,
So
and
I
I
think
can,
both are options, sorry.
no, I was going to say, I think I can add to that a little bit from the student perspective too. John did a really good job of explaining kind of the traditional delivery pathway, but we're in a really unique position now in the industry where healthcare administration can be applied to any industry really. So you can go into like the employer benefits side at Target, Best Buy, 3M. You can go into something like Optum, the health insurance unit health group. Digital technology is becoming a huge piece in the healthcare administration field. So there's really a lot of options beyond just kind of your traditional healthcare system, if that's what you're interested in. And I think from an MHA degree perspective, it really, the reason I was attracted to it is because it really allowed me to take these social determinants of health and public health concepts that I really resonated with and learn how to operationalize them. So that's why I chose the MHA degree.
Awesome, thanks for sharing. Okay, so the next question I have, maybe our MHA representatives can answer this one. And so what are examples of experiences that help prepare students for health administration roles?
I would say volunteer internships, those types of experiences are essential when looking at an MHA program. Our program, our full-time program really doesn't require any previous experience within healthcare, but it's definitely beneficial. We've had students do amazing things, students who have gone on mission trips, students who have worked the summer between graduating and coming into our program at a healthcare organization, doing pretty much anything just to kind of get that exposure to healthcare in the field. And it's been it's an essential kind of experience to understand really what you're getting into when you're coming into our program. John and Kristy or Autumn, do you have something to add to that?
I'll just say maybe if you have the opportunity to do an internship while you're in your undergrad program, that would be a great opportunity. It won't take as much extra time before you're in the interval where you're graduating and applying. And as like Katie said, volunteer work is definitely helpful there too.
Are there specific volunteer roles in mind, or really we're thinking more broadly, like volunteering in general?
More broadly, honestly. I mean, what we want to see in our program is individuals who really care about their community and want to invest in the communities that they serve. And I think one way of showing that as a student is showing that you're giving back to your community and volunteering in different ways in different sectors. I mean, even outside of healthcare administration, I think that that's an essential part of putting that on a CV or a resume when you're applying to a healthcare administration program.
Awesome. Great. Shows that you're invested in community as well. So this question, I think maybe our student John and Kristy can answer this. If someone is interested in healthcare administration and considering graduate school, should they go directly into a master's program, or better to work for a bit first? And could you tell us what you did?
Yeah, great question. So I think it really depends on you as an individual. So my cohort of first year MHA students has a variety of people that have work experience versus people who graduated undergrad and applied directly to the program. It's a pretty even split, with I think more people on the hello, Fred's little friend there. It's pretty even, with maybe more people coming directly from undergrad. Personally, I went and I worked after undergrad for 5 years at a health IT company in Wisconsin. That was something that I was looking to do both from a financial perspective, but also I didn't know that I wanted to go to grad school right away from undergrad. So it really, you can go down either path. For me, it was the right decision to work first and then go to grad school, but that is not the path for everyone.
Yeah, I guess I would add that I've seen this work both ways within my own family. My son has actually graduated from the MHA program at the U. He went directly from his 4-year baccalaureate degree into the program. And I actually spoke with him about it because I was just kind of curious on his perspective. He's been in the workforce now as a manager within one of the health systems in Minneapolis for about 7 years or so. For him, he certainly felt at times there was a gap in what he didn't know and understand about the health system itself, kind of based on not having worked in it. But as Katie mentioned earlier and others, the volunteering he had done, some of those other opportunities created some, context for him to be able to understand and apply those things to what the curriculum was and the projects and things that he got into as he went through the program. I, on the other hand, I probably worked in more entry level and administrative jobs in different departments, and that's where I gained my knowledge and experience, and ultimately, which led to leadership roles for myself. So I think that there are great opportunities out there to network and understand. Whatever you can learn around all of this will help you and guide you in, as you make career decisions and learn about the health system, because it's certainly so varied and complicated and interesting too, actually. So
Yeah, and I think I had, to both John and John's point, I came straight from undergrad, and so I definitely see a unique balance in the class when you're working with other peers who did come straight from undergrad. We're a little bit more dreamers, if you will, whereas people who came from the industry are a little bit more realistic on feasibility. And so it's a really good opportunity for us who come straight from undergrad to go into the program and understand that like there is only a limited amount of money and there is only a limited amount of ability to gain buy-in from leaders. And so getting some of those skills from people who did work in the real world first is really valuable. And then I think too, people coming from industry into the program, I think it's invigorating for them to see like the energy and the enthusiasm that may have been dissipated throughout their career as well. So.
That's great. I think it enriches that learning experience for all students and faculty in the department.
And we do have a question from the chat. If anyone is welcome to answer this, if you could give some examples of volunteer intern opportunities available, especially for an alumni audience that doesn't have the same ties to education.
I'm working on replying directly to the audience and everybody, but basically what I was just saying is like if you go to your local hospital, there's oftentimes like a formal application that you can apply to, and you can work as like a greeter, or I know some hospitals, they allow you to like just hold babies that have had narcotics in their system from birth. So there's some opportunities directly like that. That's a little bit more formal, but that's usually within the more 8 to 5 role. So I would recommend signing up for like a soup kitchen or Feed My Starving Children. There's a ton of food banks and food shelves that operate usually outside of that 8 to 5 hour that can use one-off or ongoing volunteer opportunities as well. And I think what Katie said about volunteering not necessarily directly within the healthcare system is very valuable, because a lot of health doesn't come directly from like the medical care you receive. And so it's really eye-opening if you go to like schools and volunteer, if you go to food shelves or places like grocery stores or anything like that. So just do a little Google search. I know Twin Cities has like hands-on Twin Cities, I think, that you can sign up for both ongoing and one-off opportunities.
Yeah, MHealth Fairview, we certainly have a robust volunteer program. People can apply within the organization and volunteer at different locations, some of the different hospitals we have. But I agree with the other panelists who suggested other opportunities to volunteer out in the community where you'll see public health issues appear in the situations that those organizations are striving to help. And that I think is equally as valuable as getting some experience in a hospital setting, for instance.
Awesome, thanks for answering our participant questions. And that answers some of the questions I was going to ask too, so I'm really glad that we got to that one. My next question will be for our admission representatives. The question is, what are the admission requirements for an MHA, and what's the difference between that and a Master's of Public Health?
Yeah, so generally for the requirements, we look for GPAs of 3.0 or higher. We look for a letter of intent. We want your resume, your college transcripts, and then we ask for 3 letters of recommendation. So those are kind of the main requirements. And the difference between MHA and an MPH is MHA is more leadership and management versus MPH is more of public health practitioner work. So you would see in MHA people in the role of like a hospital operations, practice manager, patient safety, kind of those roles, compared to an MPH who would be doing more community outreach kind of roles, health educators, things like that.
So a variety of experiences. And do y'all talk a lot about like a holistic review of the admission process?
Yep. So It is a holistic review. So from beginning to end of the application, one thing to take into consideration too is that statement of purpose, that letter of intent. That's a really important piece for our program specifically, because that will allow our admissions committee that's composed of faculty to really get insight into why you want to be in healthcare administration. So it's your chance to kind of show your knowledge of the field, what it is, what you want to do with it, and tell your story of how you got there. So I would say that in the entirety of the application, every piece is equally important, but that letter of intent is really an opportunity for you to express yourself to the committee directly. We do have an additional step to our application where there is an interview process as well. So after an application is received and reviewed, the admissions committee does a holistic review and determines whether or not they want to invite that candidate in for an interview. So that would be step 2. If you get invited in for an interview, this year they've all been online. Typically we've had them on campus and online and a mixture, but you interview for about 30 minutes with a combination of faculty and alumni from our program. And then you also have a chance to meet with program leadership and program staff and get your questions answered around our program.
Great. Oh, go ahead, John.
I was going to say, so there's the question in chat about the relative timeline for applying to the program. So applications for the fall of 2021, which would be class of 2023, have closed at this time, but applications for the fall of 2022, class of 2024 generally open in October around of this year. And that application is processed through the School of Public Health application service portal, which is SOFIS, which we can also put in the chat as well. So that's the timeline at this stage.
Yeah. So, and just one, SOFIS opens in August, so you can start applying in August. Our program doesn't necessarily start reviewing applications. To John's point, it has to go through a verification process through SOFIS. It gets sent to the School of Public Health, and their admissions office verifies that all the materials are there, and then they send it to our program. And so to John's point, we start reviewing applications probably in October. So even if you submit in August, we'll probably start reviewing in October, with interviews starting in November and December.
And then generally just deadline is about mid-March for our program.
Yeah, these are such important questions, because as students who are maybe have already graduated and are currently doing gap year experiences, like these timelines are important, and they have to get these different components ready, because usually you have to prepare like a year in advance to have all those materials ready. My next question, this will be a question for John from MHealth Fairview. What are the typical job titles, roles, and responsibilities of bachelor's level jobs within healthcare administration?
So there are going to be a wide variety of those positions that would be opportunities for individuals with that bachelor's degree to consider. I think some of them might be in the business services area, could be things like performance improvement departments, financial analysts, other specialist roles.
Oh no.
What?
Hello?
Can you hear me? I'm still here.
Yeah, we can still hear you, John.
Okay, somebody but they're losing their connection, I think. Okay, so financial analysts, areas that are supportive departments within the system, I think, staffing and scheduling areas where we're coordinating patient scheduling or the staff scheduling of staff. Those are things that they'll vary by role, of course, certainly some not requiring a 4-year degree, but others that would. So those are, I would say, the primary areas. Could be in a clinic setting, could be along the lines of a system operational department too that supports more than one entity or hospital, things like that.
Thank you. I actually got lost. I had my internet turned off and now back and running. I'm glad that things are still rolling. So thanks for sharing, John. Would anyone else like to contribute to that as far as like other like experiences, job titles, the various responsibilities within related to healthcare administration that wouldn't require like an MHA?
I think from like the consulting side, you can get into an analyst role, or if you're interested more on the policy side, you could be a policy analyst. There's a lot of really good entry level positions for getting into an MHA degree. And I think too, the unique thing about at least the Minnesota program is we take people from all sorts of different backgrounds. So like I know one prospective student's an engineer student, and they're just interested in getting more into the healthcare field. So I don't really think that there's like a hard stop on what you could do with your before going into the MHA program, but definitely thinking about those patient safety roles, community outreach personnel, there's really no limits to what you can apply with.
Yeah. Oh, go ahead, Liz.
Oh, I was just going to add in, I know from our first destination information from our recent grads who are finishing their undergrad degree, they go into like areas within kind of any business function that you can think about within a healthcare sector. So they may be going into entry-level roles within human resources or marketing. They often have a job title called something like coordinator. They may work in quality, have a job title, something like project management assistant. They may work in patient billing. So they work in a lot of different business functions, just, within the healthcare industry.
Oh, go ahead, John.
I was just going to tack on that the company that I worked for prior to enrolling in the MHA program primarily recruited undergraduate students to work in health IT, and that a lot of my coworkers who used that opportunity in that job role to then branch into different aspects in the healthcare industry as well, whether that was in healthcare administration, more IT, or continuing on to be a provider, whether that's a nurse or a physician as well. So definitely lots of opportunities. Healthcare is a big space and there's lots to do in healthcare in the sector.
Could you tell us the name of the organization you worked with for the 5 years before you started your program?
Yeah, it was Epic Systems, which is in Madison, Wisconsin, technically Verona, but yeah.
Just 20 minutes outside, right?
Yes.
Yeah, and I've seen them on our campus too, recruiting U of M students for internship opportunities and entry-level positions, as John had mentioned. And so, yeah, they're right. And I've seen on there, like when I looking at their job description, they list open to all majors. So regardless of your academic background, in undergrad, they're very open as long as you have somewhat of like a genuine interest in the organization and the role that they're hiring for. Okay, so another question here. I think anyone can respond to this question, but we have many students here at the University of Minnesota, ranging from first year students who are exploring majors to who are near graduation. For those early in their collegiate career, they might feel as though they don't have any professional connections, particularly within the health administration field. How would you recommend they get to networking and building their professional network? What do you personally like to see when students are networking with you, particularly in this virtual environment?
I can take that one for the beginning. So one thing that really drew me to coming to the University of Minnesota MHA program was the alumni network, and I think that has really manifested in a way beyond what I even expected, which I really appreciate. And what that means is that people are willing to talk to you if you reach out to them. My primary source of finding people to talk to is LinkedIn. There's not like a there's not really a secret to it other than typing in UMN MHA into the search bar and finding who I want to chat with. If people are reaching out to me specifically, I think the thing that I appreciate is knowing who you are and what your specific questions are. Email is an easy way to get into contact people, but also LinkedIn messaging is great. I've had people connect with me from my previous employer as well as prospective students on LinkedIn. And I think both email and that function are completely viable. And then it looks like there's the U of M Alumni Association Maroon and Gold Network too. So I'm going to pass it off to whoever just put that in the chat.
I just dropped that in as a resource for our attendees. That's our official network where you can connect with U of M alums who are working in specific industries and job titles that are ready and willing to connect with you. That's why they signed up for the Maroon and Gold Network specifically to reach out and meet with you and share their perspectives on the jobs. So it's a really excellent resource to check out if you haven't already done so.
And just to add on to John, what John was saying too is our MHA alumni members, they're all happy to talk to anybody too, in addition to that. And that's one of the things that we tell our prospective students, our current students. Networking is super important. And really there's an expectation when you graduate from the MHA program at Minnesota that you give back. So that means if a prospective student, John, in a year when he graduates and he's out there working, if a student reaches out to John, then we're expecting John to respond just as any other alumni would have responded to John. So that's a really, it's a point of pride for our program. And if you're kind of trying to think of a way to start that conversation, to John's point, and I don't know how the Maroon and Gold Network works, but on LinkedIn, when you Google that, you can find different organizations and where people are working. And one thing that's helpful is to reach out for an informational interview, just what their role is, what they're doing. That's a fantastic way to network with any of our alums that are in a position out there that you kind of find interesting. And it's a great place to start that conversation.
I would add that scour the job boards, look for volunteer opportunities, and start to work on developing your own network. I agree with Katie wholeheartedly about the U of M's program in terms of the alumni being advocates for the students in the program. That's an experience my son had as he entered the program. He sought out and reached out to people who were very responsive. And I would tell you that as leaders in healthcare organizations, most leaders are very willing to do an informational interview. So if you connect and volunteer, you can find a way to meet someone who will hopefully take the time and have an interest in meeting and helping guide you around these things. And that's the way I did some of the things I did to gain traction in my career. And so take advantage of that and go forth and do some of those things, and you'll find some successes there, I think.
Very insightful information. We do have a question in the chat asking about, are there scholarships available for people trying to seek a master's degree, or is that not a thing after undergrad?
Yes, I can take that one. I'll start by saying in the MHA program, with the holistic review, so we review, and if we decide to admit, we will generally offer some sort of scholarship. It's like 90% of our students get a scholarship from the program, whether it's in-state tuition. GA positions are also determined at that time with a scholarship. There are also links from the School of Public Health for graduate scholarship opportunities too, which I will pull up and grab here shortly and add to the chat. But yes, we do offer a wide range of scholarships for students looking to come into the MHA program.
Speaking of graduate assistantship, what types of graduate assistantships are available in the program?
I will gladly talk about that, as I have held 2 roles as a GA this year. So one of the roles that I have held this year was actually working with Katie, as well as one of our faculty members, in coordinating the residency information. So a residency is the summer internship program, I guess, and basically it's a summer internship that you have to do as part of the MHA program, and applying for those positions is part of the process as well. And so my role was identifying those opportunities from around the country as well as our past years, and putting that information together in a way that current students were easily able to access that. And then the other role that I'm doing is actually part of what I'm doing here today, which is part of the admissions team. So that's both providing information to prospective students, just like yourselves, as well as participating in interview days to talk a little bit more about the student experience, helping Autumn and faculty make sure that the information is coordinated. My other GA colleagues do a variety of things. So some are research assistants, helping out with different faculty on different research projects that they have, whether that's data crunching, data gathering, as well as TA positions as well. So helping faculty grade, provide additional context in class. All of those different opportunities are sort of related to the GA position and sort of which route you go down.
Awesome. I love the variety, and you can kind of lean on your interests to determine like what type of like graduate assistantship experience you want to have.
Interest and need, I would say, are definitely the two areas. Yes.
Well, as we wrap up here, what are, I guess, words of wisdom you'd like to share to our panelists who are actively searching for jobs and internships, getting ready to start the graduate application process, and in the midst of like a gap year? Any final thoughts, things to share?
For those who are planning on applying, I would share apply early. We're rolling admissions in our program. We're number 2 in the nation for healthcare administration programs, and it's better to get in there sooner than later just with our processes. So that would be my word of wisdom for anybody applying directly.
I would, if you're thinking and considering applying for a position in a healthcare system, I think the things I would tell you, make sure you demonstrate your genuine interest in the work. Come prepared with questions that you can ask that person who's interviewing you about that health system. Understand a little bit about it before you engage in that conversation. So do some research on the organization and understand that. Be curious, ask questions about how the health system works. I think that is something that leaders really look for and want to have an inquisitive mind of someone who's being thoughtful and thinking about how this all interrelates, because it is well connected in so many ways across not only the health system, but also how it serves the community, and we create good customer service, but also safe patient care.
I guess to piggyback off of John a little bit, when looking into MHA, definitely do your research. Make sure that this is the right path for you. You can definitely contact us for any questions you have. We're always happy to help. And then that kind of ties into part of the application with the statement of intent too. That's like Katie said, we really do look at that as in your application to determine interviewing. So that is an important piece to show that you are very interested in healthcare administration, you know what you're talking about. And another thing, I think student MHA John would agree, definitely have sources that you are looking at about healthcare, whether it's journals, articles, things like that, to sort of be connected with current events going on in healthcare.
Yeah, I'll share a couple of mine if that's useful. So there's a website called Modern Healthcare. It's a publication that talks about what's going on in healthcare. There's a website called HIS Talk, which is Health Information Systems Talk 2. It was a website that I checked every day in my job since it was very specific to IT. And now I look at it about once a week just to see if anything crazy has happened. But those are two ways to sort of keep up with what's going on. There's also a School of Public Health, Health in All Matters podcast. There's lots of health podcasts. So if you're interested, I also listen to one called Talking Pediatrics, since that's my area that I am particularly interested in. So consume news information from a variety of sources is the other thing that I would say.
Excellent. Great. John, since you're a student, what are your plans after you graduate? Have you thought that far? And it's okay if you haven't. Just curious as to like kind of what are your career goals with earning your Master's of Health Administration degree?
Yeah, thank you for that question. So my fiance lives in Madison still, and I'm actually in the apartment. You can't see it, that's fine. I'm in the apartment that we share together right now because of virtual school. My goal is to work for a pediatric organization in Wisconsin. Hopefully, there's a American Family Children's Hospital that's here within Madison, which would be my top tier choice. But otherwise, there are some other great healthcare organizations within the state. My goal right now, it's just to work in the pediatric field. I'm hoping my summer residency this summer sort of gives a little more clear direction on what area I want to work in, whether that's strategy or operations or something else that I don't even know yet. But those are some of the areas that I am considering. Yeah.
Thanks for sharing.
One thing to add to that is there is an entire, what John's talking about, there's an entire fellowship process. So he just went through the residency process where he's going to be doing a summer internship at an organization. Over the summer, the students who decide they want to go into a fellowship, which is essentially an extension of an internship, it's a year or 2 year long employment opportunity with an organization, they'll start applying in August and September to where they want to go when they're done. They follow certain timelines. So usually you apply until October 2nd is the deadline for most of the applications. And then you find out typically in the beginning of spring semester where you've been accepted. So that's one route. I would say about 80% of our students choose that route when they're done with the program. The other 20% either go into full-time employment or into consulting. So.
And I am not sure which path I'm going to take yet. So that's why I didn't say that, because TBD.
And it's great that even like in your grad program, I'm glad that y'all noted that, because like you don't have to know exactly what specific area you want to be in before you apply. Like there's still that room to explore.
Yeah, I think so. Kristy is a good example, as well as one of the other second year students who swapped what they expected their post MHA experiences were going to be. My friend Brandon thought he was 100% on the fellowship train, and after his residency decided to continue employment with the residency organization that he worked for, which is United Health Group. And Kristy, I think, was on the opposite path, where she was planning on exploring employment and is now doing a fellowship at Geisinger, like she mentioned. So it really, 2 years is not that long of a time, but a lot can change, especially in what you want and what you're interested in. So yeah, I'm keeping that open a little bit at this point.
It's really good to hear. All right, and I want to be mindful of our time, so we'll leave it open for another minute. If our panelists have questions, feel free to plug your questions in the Q&A. We'll be around for another minute. Other than that, I do want to say thank you to your panelists. Oh, go ahead.
Yeah, and I just wanted to plug our career offices too. So current students have your career centers that you can connect with. Liz and Marlena are in specific college-based career centers. I'm in the Pre-Health Student Resource Center. We work with all colleges and all students and alums. Because I think that's an important distinction to note, that not all pathways into a health career are linear, and some people do go out and work for a while and then come back, and our office is still there to support you no matter kind of what you decide on and where you're at in that pathway. So so yeah, connect with our offices. I think it's great to show interest in these areas so that we can help you determine the best pathway forward as well, to get you to reach your goals, wherever they may be.
Right. Well, thank you everyone again for your time and sharing your own personal experiences, talking about processes and the value of experiences in gearing up for like a career in health administration.